we have a number of very excellent questions that all of you have submitted. I'm going to ask these questions, and Dr. Newman will provide the answer. So, Dr. Newman, why don't you come and join me up here? All right. The first question that has been asked is, Dr. Newman, what you have discussed is the stem cell lift. Can you correlate that with the product Luminesce?
The stem cell lift, basically, we're using true stem cells, the cells themselves. So we're taking the cells from the fat, separating it out, and then injecting it back into the body. The cells are producing what is in Luminesce. But there's no cells in Luminesce. Does that make sense? Yes. Okay. So in the laboratory, we grow the stem cells, and we get the language that we talked about, and we bottle it. In the body, they're producing it naturally, and that's how it works. Now, a lot of times I tell my patients to use Luminesce in conjunction with the stem cell lift because they'll see a faster result, they see better results, the skin gets better. So that's how they correlate. And the main thing to understand is that there's no live cells within the Luminesce.
Thank you. Can you discuss further if there are studies showing the effects of Luminesce to substantiate the results that we are seeing?
I don't know if you remember when I showed the slides with the percentages. That was actually a study that was done on the product, and that study was basically showing how people who use the product under controlled circumstances benefited from the product. If you want scientific studies in terms of biopsies and looking at it under the microscope, it's hard to do in a cosmetic setting because how many of you are willing to have a scar on your face? So I can't do it. I mean, I can do it and put it on their arms and then, but for cosmetic reasons, most people are not willing to have a scar. So I don't look at it under the microscope for Luminesce in terms of the cosmetic end. But if you look at it for the other things that we've done for wound healing, there's a lot of data for the stem cells. So there's a lot of data out there, but not on the product for cosmetic just by itself. But if you look at it in terms of objectively, looking at it, which is what they did, and doing a clinical study and not a basic science study, we're not looking under the microscope, by looking at the skin, looking with magnifiers, that's what the result is.
In the KABC video, the results of your stem cell lift are very dramatic. Can we say that the same technology is what makes Luminesce such a powerful product?
Yes, absolutely. It's the same technology. It's the stem cells that are doing the rejuvenation. The difference is when I'm doing the procedure, I'm also giving volume. So I'm putting fat, and that's giving you a volume. Luminesce is not going to give you volume. It's not going to make you plump up like that. But it's going to talk to your cells to renew themselves, to make your lines better. It's going to make your skin smoother. It's going to take away some of the damage over the years that has come just through aging or through lifestyle or through sun exposure. Is going to reverse some of that. So that's the same process that's going on when you put on Luminesce on your skin. Is going to be telling your skin, make new collagen, make new elastin, make new blood vessels, so that it's youthful. But when you're putting the fat in, it's giving you the volume, and that's the major difference between just putting the product on versus if you're doing the surgical injections.
Anti-aging products are very popular with people in the baby boom generation. If younger people in their 20s and 30s, for example, use Luminesce before wrinkles are a problem, will the stem cell technology of Luminesce help to slow the onset of the visible signs of aging?
Wow. Very good. If you notice, most of my patients that I showed you were not all young or were not all old. There was a range of patients that we used. And most of the changes that you saw was really just turning back the clock a little bit. So if you wait till you're, what was the age? Baby boomers? 60, 50, 60, and then try to start to take care of yourself. Obviously, you're not going to do as well as if you start younger and you maintain yourself and you do better. If you do Luminesce at a younger age, you're starting to maintain yourself. You're not so much reversing it, but maintaining it. And as anything else in the world, it's a lot easier to keep something than to make something new. So if you have it, it helps you keep it. If you don't keep it and you lose it, it's harder to gain it back again. So if you keep it and you're doing your Luminesce, it helps you maintain your skin better, maintains your cells better. So that's the whole idea of preventive medicine, is to make sure we don't get the damage. So you should use it, and you can use it anywhere on your body. I mean, we're using it for the face because, you know, that's where most people are worried about. But I've had people using it on their hands, on their necks. You can use it and see benefit just because it works on all parts of your body. So it's a good thing to do as a preventative.
I am using only Luminesce on my face these days, but for makeup, etc., can I also use other products in combination with the Luminesce?
Absolutely. Luminesce is only one part of a skincare line. That's why we're going to bring in other products to complement Luminesce and that will incorporate this technology within the product line. But right now, I have patients who use Luminesce, and I tell them, you still need to use your sunscreen. You still need to use your moisturizer. You still need to put on makeup. And once you wash your face, the first thing that should go on the skin is Luminesce. After that, you can put anything else on. But you don't want anything between your skin and this Luminesce because the products will not penetrate. That language will not go through another cream to go into your skin. So if you want the effect, you got to wash your skin, put it on, and then put everything else on. And if you put on a cream on top of it, it's probably you're gonna get better results because it'll drive it in to the skin and you're gonna get better effects.
Here's a question similar to what you answered a moment ago. Today, Luminesce is generally promoted to be used on the face. What other benefits are to be expected if we use Luminesce in